Today, Dr. Kylie Burton is here to talk about how to interpret your lab results. Kylie, thank you so much for being here. I'm so excited for this conversation.
Yeah, me too. I love talking about blood work, especially when people get told it's normal and they're like, I feel terrible. Why are my labs normal?
Yeah, I'm so looking forward to this conversation. So, Dr. Burton, how did you get into, what inspired you to start working with these numbers?
That's a long story, but I'll shorten it. So I've always been interested in nutrition and being able to heal our bodies with food. Got into my bachelor's degree. It was in nutrition. I learned the food play. I learned the food pyramid. I learned um, they call them RDA values. So, like the amount of vitamin A you should be getting per day, the amount of vitamin C. Yeah, chuck those out the window because those are like, take this so you don't die kind of level. But that's all that I learned. Functional medicine was nowhere in my vicinity. I had no clue what it even was. I'm a chiropractor by degree, had no clue what chiropractic was. I got hired on as an assistant to a chiropractor here locally. And he introduced me to this whole entire new world of functional medicine that I had no clue. And I'm like 22 years old. I had my bachelor's degree. So I decided after so many women would come in and they would tell me of libido problems and menstrual cycles and menopause and iron issues, all the issues that us women deal with. And then they would be like, but don't tell the doctor. Because they didn't want to just tell a guy about their women problems. So I decided, screw that. I'm just going to go get the dang piece of paper myself so I can help these women in the ways that they need help. So I did. I went down the road of chiropractic. If I were to go back and do everything over, I would probably go DO. But most importantly, I did functional medicine. And I didn't just dab my toes in the water, like I dove in. And I learned as many labs as possible because I believe labs can tell us a lot. Here's the problem though, functional medicine labs can be expensive. You can spend multiple thousands of dollars on it and still not get very far in your healing journey. So I had to figure out how can I minimize the cost of these functional medicine programs that can be so hefty. And how do I take blood work that people already have, because they have oodles and oodles and oodles of it, and use that blood work to get the real answers that I'm looking for, even if they've been told it's normal. So I went down and took several seminars, anything I could get my hands on to make sense of blood work, just the blood work we get from our doctor's office, and how to use that, of course, to actually help people heal. Not just say, oh, your labs look great. Maybe you should try an antidepressant. Come back in 6 months. Or let's change your thyroid medication. You know, all the stories that we get told. Well, so I did. And it's going to become my go-to thing I love to talk about because we all have it. So if you're listening to this right now, go grab your blood work, whether it be on your patient portal, whether it be in your hands in a binder you've been keeping track of, wherever it is, go get it because you're going to want to see what your numbers are as we start talking about them. And that's how I ended up talking about blood work, is because I had to solve problems along the way. And the biggest problem was, how do we bypass functional medicine lab tests that can be so pricey and expensive?
Okay. And so what you're talking about is just a standard CBC panel?
Uh, Yep, CBC, metabolic panel, lipid panel, thyroid panel, vitamin D, hormones, like just a regular blood work that we have from our doctor's office. How can we use it?
Okay.
I'm going to teach you.
Well, let's start getting into this. Let's start with the CBC panel.
The CBC. Okay. Now I know your audience is smart. So we're going to get into a few markers. But the CBC is what I call the lab test worth the price of gold. The reason why is because if you're dealing with anxiety, depression, thyroid, autoimmune disease, chronic fatigue, any long-term illness. Now, if you're dealing with acute stuff, like all of a sudden you have a gallbladder burst or kidney stones or something like that. That's not my jam. My jam is the chronic stuff. The ones where you know you're not crazy, you know something's wrong, even though everybody's telling you that everything's fine. So if you're sitting in that scenario, the lab test called the complete blood cell count, the CBC, is the lab test worth the price of gold if you know how to read it correctly. And I'm going to teach you guys how to be the best person to read your own labs, okay? So grab your blood work, and at the very top of the CBC, there's this marker called WBC. It's the white blood cell count. Now that white blood cell count is important, but it's not the most important because it's not the most accurate, okay? Now, depending upon your lab, they will have a normal range. Now let's talk about the normal range versus what I'm going to teach you are the functional ranges. The normal range is they took thousands of people in the area who were, quote, healthy, meaning they don't have a diagnosis, a list of 10 times or more long. And they said, okay, since these guys are healthy, they're going to create the standard. And that's what your normal ranges were created on. Literally, sick people in your area who were, by definition, in our world, healthy. We don't want to be compared to that. We want to be compared to the woman who was vibrant, functioning well, and being the person that they want to be, not having health issues in the background. And that's where the functional range comes into play. Okay, so just as a quick example here, the thyroid marker TSH, thyroid stimulating hormones, the most popular thyroid marker out there. It's also just one piece of a puzzle. So just think about that. Every single marker I'm going to teach you, we're going to do a handful of them today. They're just pieces of the puzzle. And the more pieces of the puzzle you have, the more complete your puzzle is. So if you're like, I have thyroid issues, I have every symptom under the sun, and yet you're only getting a TSH, your puzzle is missing a lot of pieces. Okay, so the TSH marker, the normal lab range on any given lab test is between 0.5 and 5.5. Now that would be like me saying, hey, go find your favorite restaurant, and giving you a map and saying it's somewhere between California and New York. Good luck. You ain't going to find your favorite restaurant amongst the entire state, the entire country. But if I say, okay, go find, Brandy, where you're located.
California, San Diego
What
County,
part?
North County,
Okay.
Vista.
If I were to say, go find your favorite restaurant in San Diego, could you have more success doing that?
Yeah.
That's what we're doing with the lab ranges, is we're taking the big range and we're condensing it to the small range and saying, okay, now you've not only are you healthy, but you feel good when you're inside this range. And to continue with the TSH, the 0.5 to 5.5 turns into 1.8 and 3. So we went from big range to small range. Okay. All right, that's separate thyroid stuff. We want to talk about the CBC because it's the most common blood test everybody has. Your insurance pays for it. It's, given. Now we're going to pray that your physician, whoever ordered your blood work, got a CBC with differential. A CBC that's missing the differential is only the lab test worth the price of a penny. That differential is so important. That's why this lab test is worth the price of gold. Okay, and on that very top line, the very first marker you see is the white blood cell count. That WBC, I don't know what the normal range is, but the functional range is 5 to 8. So anything less than 5 or greater than 8, your body is fighting a low-grade infection. These are the type of infections that go unnoticed. However, they are the most common cause of anxiety and depression, autoimmune diseases, and chronic fatigue. In fact, research says that type 1 diabetes is triggered 95% of the time a virus attacking the pancreas. but it goes unnoticed because we're not trained to read blood work the way we should be, unless you're learning this functional stuff. Okay, so if you're like, my white blood cell count is 9.2 and it's been like this forever, my doctor doesn't bat an eye over it. Well, of course they're not going to, because they don't know anything different. I want to be very clear here. This is not your doctor's fault. This is the schooling in which we are all trained in. We have to bust out of the schooling system and learn the better ways. So you literally go get a really expensive piece of paper that gives you a few things that you can do, and then you have to go, okay, now I have to go learn the real stuff in seminars and programs and all the other stuff that we have to take to get to where we are today. So white blood cell count 5 to 8. If it's less than 5, greater than 8, you're fighting an infection, but don't stop there. Because on occasion, you'll see like 5.5 or 7.2, and it's within that range. But we always have to go check the differential portion. Okay? You following me, Brandy?
Yeah. So what is the differential portion?
Okay, so we're going to jump down. So you have the white blood cell count at the top. And then you have your
Okay.
markers that we want to get to, but we're going to get to them later. The red blood cell count markers. So the red blood cell, the MCV, the MCHC, and all these multiple markers that break down the red blood cells. Then at the very bottom of it, you'll see 5, hopefully 5 markers. And those markers
Okay.
are the neutrophils, the lymphocytes, the monocytes, eosinophils, and basophils.
Okay.
Those 5 markers tell us about the white blood cells. Now, the white blood cells are responsible for fighting infections. These 5 markers will identify what type of infection your body is fighting. Anxiety and depression, I can almost guarantee you're fighting an infection because your body is so busy fighting what's on the inside, it has no energy for anything external. So you feel depressed. Or it's so busy fighting that any small type of stimulation sends you into an anxiety attack. Does it make sense?
That absolutely makes sense.
Yeah. It's also the number one reason for chronic fatigue because your body's fighting these infections on the inside. And unfortunately, I can't tell you where they are. Usually they're systemic, so usually they're all over the place. Or what happens in individuals is that their genes communicate with the body and tell them where to hang out. So, for example, in my family, it's Parkinson's disease. Well, the infection attacks the nervous system. In somebody else's family, it's Hashimoto's, and the infection attacks the thyroid. In another person, it's Crohn's disease, and the infection attacks their large intestine. So it really is just dependent upon what's the weak point in your body, what are your genes communicating it to do.
Yeah. As someone who has had Lyme disease, I can
Oh, geez.
just attest to what you just said about the anxiety portion of it and also the fatigue portion of it. I mean, I'm not one to struggle with anxiety or fatigue normally, and while during that time of my life, that was the two symptoms that I was experiencing in spades. Um, so yeah, let's yeah,
Let's keep
let's
going.
keep going here. Like, I mean, there's so many directions we can branch off into. I really would like to understand these blood numbers, but what you've just said, it's okay, so we have the same infection that could potentially be attacking these different areas of the body based on our genes.
Mhm.
Okay.
Yeah, there's a really hot commodity or a hot topic right now is parasites. And people will say, well, I went and did a parasite stool sample with my doctor or with whatever lab test they're sending into the lab. And it's a teeny little bit of our stool that they put underneath the microscope. And if there's nothing in there, then it comes back negative. Well, parasites are
Yeah.
really good at surviving. They're going to live in any tissue that they want, not just the digestive system. So we just have to think that, one, we don't know as much as we want to know about these. And two, I personally don't care. Because what I know is that the treatments I'm going to give people are going to handle the systematic approach to it. They're going to tackle them wherever they may be in the individual. And then I'm going to provide the immune system everything it needs to do its job, which, it's catch 22 in 2023. How dare we support the immune system and give it what it needs? We just want to shut it all up. So it's this idea of, let's figure out what is in the blood work. Let's figure out what's underlying hidden amongst all of these symptoms. And I can say, we can sit here and pinpoint symptoms, but let me give you another example here. This is the weirdest thing. So I'm a chiropractor by degree, right? I had, back in the day when I had a brick and mortar practice, I had a young mom come in and she had what they would call frozen shoulder syndrome, meaning she couldn't move her shoulder. She's like 31 years old, has a newborn baby and a toddler, and can't pick them up. So it was debilitating to her. Woke up one morning, her shoulder hurt, and it just never got the same. And 30, 60, 90 days later, it now won't move. She had tried multiple different chiropractors, multiple massage therapists, multiple injections in the shoulder joint there. And I was like, okay, well, if you already tried all that, why would I keep trying it? Let's do something else. Along your journey, did anybody take blood work on you? Oh, yes. My doctor took it on me, just, said it was normal kind of thing. Well, why don't you go to your doctor's office and go get it? Go get it for me. So the next time you come in, bring it in. Okay, this is why the CBC lab test is worth the price of gold, because I looked at her neutrophil count, and her neutrophil count was 88%. You want it less than 60%. Now, medically, a bacterial infection, there's no way it can cause frozen shoulder syndrome. It did. I never touched her shoulder. I never adjusted any part of her. We cleared out her bacterial infection. She's fine 30 days later.
So when you say you cleared out her bacterial infection, are you referring to use of antibiotics or are you referring to something
Supplements.
else?
Supplements.
Okay.
Yeah. The antibiotics, they destroy everything. Where the
Yeah.
supplements, you can get in and get the bad guys out. And here's the other thing with infections too, is a lot of times you probably experience this with Lyme. They're coexist. So just because you have one doesn't mean you can't rule out the others. So think about people who have
Right.
UTIs, chronic UTIs. They take an antibiotic, it comes back 30 days later, it comes back a year later. Like, they are getting chronic, multiple reoccurrences of their UTIs. Well, they're tackling the bacterial component with the antibiotics, but not the fungal. So the reoccurrence just keeps happening and happening and happening. So these infections coexist. Let me give you one more example. Mom, I worked with a few years ago, MS. Okay, she had been diagnosed with MS like, I want to say late 30s. So pretty early on in life. She had 4 teenage boys. And what they were doing for treatment was every month she would go in and get an injection. And this trial injection would make her bedridden for 3 days. She's like, I can't do this once a month. For the rest of my life, I got teenage boys I got to keep up with. So I was like, okay, well, I know that MS is just a set of symptoms. It might be some ugly diagnosis if we want to think about it like that, but realistically, any diagnosis, any set of symptoms, it's just our body's presentation of saying, hey, I'm struggling and I need help. And when we can remove the search or stop searching for a diagnosis, when we can remove the idea that we have to have a diagnosis in order to get answers, and we just say, you know what, my body obviously needs help. It's telling me, it's communicating that. What does it need to get healthy? And as you give your body what it needs to be healthy, the symptoms just start going away. Okay, so she has MS. Now, I don't know if you can ever reverse that technically, or say that you've cured it, but she doesn't feel anything from it anymore. So once again, I pulled her blood work and we found parasites and we found a very depleted vitamin D status. Like it was in the teens, really bad vitamin D status. And I'm thinking, well, one, the parasites are wreaking damage, and two, her immune system has nothing. Its tank is emptied. It can't do any of its jobs because there's nothing there for it to utilize as fuel. So we tackled the parasites. She got put on a heavy dose of vitamin D, and then she's maintained at that high dose of vitamin D. She notices that if she goes off of the vitamin D, the flares start happening, And how many times do we hear an autoimmune commercial that says, to avoid the Crohn's flares or the MS flares or the Parkinson's flares? Like, what causes those flares? It's the infections that are amping up, that are more active versus dormant. You probably experienced that too with your Lyme. Like there was some days where you can be like, I can make it through the day. There were other days where it's like, count me out. I'm doing nothing today.
Well, I have Hashimoto's, and
Oh,
I
geez.
know it.
I would love to see your blood work, girl. Okay.
Okay, so how do you tell from those last five whether you have a bacterial infection or a parasitic infection or maybe an underlying viral infection?
Yeah. So we talked
Is
about
there
a
a
few
way?
cases. There's a few
Yeah.
examples there, so you can kind of pinpoint,
Okay.
like, what do the numbers look like? What do people see? There's really like no blanket. It just is a matter of, are you fighting it or are you not? And that's part of your healing journey. Okay, so we get into these 5 markers. Now, I briefly mentioned the neutrophils. The
Yeah.
neutrophils are the top of the 5. The magic number for neutrophils is 60%. Now, if you're in Canada,
Or less.
you're going to look at absolute values. You're going to have to go grab my book off Amazon because I'm not going to go over how to convert that right now, but we want to pay attention to the percentage values. So
Okay.
60% is the neutrophil number. If you're less than 60%, that's a good thing.
Okay, less than 60. Okay.
If you're greater than 60%, now we've got bacterial infections. And whenever I have bacterial, I always treat fungal at the same time.
Okay.
Okay. 60% neutrophils. Remember that. The next marker are lymphocytes. Lymphocytes fight viruses. I don't care what type of virus it is, because I'm going to give an antiviral and I'm going to support the immune system. There's thousands and thousands of viruses out there. Okay. Viruses are the number one trigger of autoimmune disease and the number one trigger of chronic fatigue. The magic number for lymphocytes is 30%. If it's less than 30%, that's a good thing. If it's greater than 30%, your body's fighting a low-grade virus. Okay? Now, when you're thinking and looking at your blood work and you're saying, oh, I have a 68% bacterial infection, I'm going to go get tested for bacterial infections. Don't waste your time, because unless you have like E. coli or C. diff or Campylobacter or something where you're literally in the bathroom for 30 days all day long, like something crazy like that, that will come back positive. Otherwise, it's just these low-grade infections that lead to messed up guts, that lead to symptoms where you just feel like crap. Okay, so neutrophils 60%, lymphocytes 30%. 60-30 is a 2-to-1 ratio. That's a good thing. We want to see the 2-to-1 ratio.
Okay.
Brandy, yours is going to be a 1-to-1 ratio. You're going to start seeing your numbers meet in the middle. So your neutrophils like 48% and your lymphocytes are 44%. The closer they are in the middle, the 1-to-1 ratio occurs, and that's autoimmune.
Okay.
Okay. Now you might be looking at your blood work right now and you might be saying, well, my blood work's 54% and 38%, so I'm not sure what she's talking about. I look fine here, right? Well, go back, trace back 6 months ago, 6 years ago, 10 years ago, and I can identify the good days and the bad days for people. Because the good day is where your blood work looks more like a 60-30 ratio. The bad days are when you experience the flares, and that's where your blood work would be that 1-to-1 ratio. Does that make sense?
That absolutely makes sense. Yeah.
Yeah, this is all from regular blood work. I can pinpoint if your body is autoimmune or not, just from your CBC. Isn't that crazy?
Yeah, it is.
Think about
Because
how many antibody tests and how many, ANA
yeah,
tests you
that's exactly
take.
what ANA test and the one with the uh what is it, the CRP, and yeah,
HSCRP, yep. Yeah, all from
yeah,
the
and then the
CBC.
sedimentation test.
hmm
Um,
That's why I say this is a lab test worth the
okay,
price of gold.
yeah. So then what about parasites? Does that come in with those last three?
Parasites are the bottom two. So basophils and
Okay.
eosinophils.
Okay.
Basophils are the magic numbers 3. 3%.
Okay.
Basophils, did I say eosinophils? What did I say?
Yeah,
Eosinophils, the
basophils and
magic number is 3%. Basophils, the magic number is 1%.
okay.
So eos, 3%. Baso, 1%.
Okay.
Now, those can also be food allergies as well. So if you have like an eosinophil count at 9% and you haven't even tried any elimination diet whatsoever, start there first. Cut out the
Okay.
bad crap first. And then if it's still high, now we're going to tackle some parasites.
Okay. So then that leaves monocytes.
Monocytes are a viral number again.
Okay.
So virus, and this magic number is 7%. Okay?
All right.
So 7% or less is good. Above 7%, we're talking viral again. And it doesn't matter if you don't have the lymphocytes, but you have the monocytes, it's still virus. So either one of those two, okay? Now, if you do the math, neutrophils, 60, lymphocytes, 30, add that up, that's 90. Monocytes, add 7, 97. Eosinophils and basophils, 3 and 1, that's 100-ish, depending on the percentages, the decimal points, okay? They're always going to add up to 100%. And the reason why I tell you that is because I get this question a lot. What happens if they're low? Like a lymphocyte marker is at 14%. I don't care if it's low because that means that something else has to be really high.
Yeah.
Because the equation
so when that
has
other thing
to
is brought
balance
back
out.
in,
Yeah.
and it's going to balance. Yeah. Okay.
Pay attention to whatever's high. It'll probably be neutrophils.
Okay.
Cool?
All right. Wow. That is super enlightening. And now it's the question of, okay, so should we talk about, supplements to support the bacterial viral parasite load, or should we talk about other blood work markers?
Let's do, no matter what, here's where you start.
Okay.
Okay. Now, I used to see these really crazy numbers and I would get all excited like a kid on Christmas. We're like, yes, we got answers. We know what to do. And we jump straight into infections and tackling those. And I realized that the body is not going to handle it very well because it's already depleted.
Yeah.
So the first thing you have to do is give the body what it needs. Vitamin D, iron, vitamins in general, minerals, healthy fats, like all the stuff we hear about that the body needs, and we're just, taking a multivitamin or or you have a smart audience who are taking high quality supplements versus Walmart crap. And that's the first step, is just get your body replenished and replenish it at high levels. So when I'm saying high levels, like my vitamin D, if people are less than 60 on a vitamin D lab, I'm going to get 25,000 IUs of vitamin D per day. Now the RDA value, that value where it's like, hey, take this so you don't die value, that's 2 to 5,000. I'm 5 timesing it. The prescription dosage for vitamin D, they only give it if you're like less than 32 and you ask for it. I've seen so many labs where vitamin D's in the teens and nothing was done. Your immune system requires vitamin D. Every single cell in your body requires vitamin D. Every single cell does. Feed your immune system, feed your cells, give your body lots of vitamin D. That's where you start. No matter what your blood work says. Give your body what it needs.
There's one question here because there is so much confusion around vitamin D, because when you start getting into my storage form of vitamin D is low, but my circulating levels are high, all of this kind of stuff. Can we maybe like dispel some of that confusion maybe here on, because I mean, what you just said, your immune system needs it to fight infection, but then there's this thought that I'm just thinking about Morley Robbins, and he says, don't supplement with D. Your body doesn't need it. And it's kind of...
I know.
I don't know. Yeah.
There's catch-22s with everything. So like if you look at an iron panel, and if you're saying, oh, my iron is depleted, well, I'm just going to give iron because that's the easiest thing. And then if the body doesn't respond to iron, I'll figure out the deeper cause to it. Because you can get into not co-infections, that's the word I always use, co-requirements. So like vitamin D requires vitamin K and magnesium and all these other things to it. Yeah, so get a good vitamin D. It has all that stuff in it. But the bottom line is, I've seen so many people, thousands of people. I get an email a week, a message on social media a week saying, hey, I did your 3-month vitamin D protocol. Life-changing. So I just start with something simple. Give your body that. If nothing happens, which I highly doubt that, if nothing happens, then fine, we'll dig in deeper. We'll dive in deeper. But start simple. We make functional medicine way too complicated.
Yeah.
Genetics, way too complicated. And then we're lost, like, well, I don't even know where to begin. So we don't do anything about it. We have the blood work sitting in our hands. We know that but now it's like, okay, now what do I do? How do I get rid of it? How did you get rid of Lyme? How do you tackle that?
6 months of doxycycline.
Really?
Yeah.
Wow. That stuff destroyed me as a teenager.
Yeah, this was 11 years ago now. But yeah, that was
the path. Okay, so you found your path. Yeah. And it was simple. Yeah. Wasn't it nice to have it simple?
Yeah, it was simple.
Yeah. That's the hard part with functional medicine. People get into functional medicine and they're like, where do I even begin? Like there's so many pieces you can do. Cell, you detox, gut, hormones. Like the bottom line is your body is one incredible machine that all works together. And when you get the hormonal system, the digestive system, the nervous system, the cardiovascular system, all these systems working really well on their own and then playing nice with each other, that's when we feel like $1 million. And rather than me approaching the hormones and saying, oh, well, I can fix your energy levels because you have low T, fine, that's great. I can give you testosterone, but that's not going to solve anything in the long run.
Right.
It's going to help you feel better right here, right now. Yeah. Why is your body not producing testosterone?
Yeah.
And let's dig in a few layers deeper. And then when someone comes to me for thyroid issues and they figure out, oh, it's not my thyroid, it's an infection. Or it's not my thyroid, it's because my vitamin D has my immune system has nothing. So it's just fighting anything it wants to fight. Like, I'm literally just going to say, okay, your body's presenting with symptoms. I don't care about the diagnosis. I don't honestly care, whatever it is. How do we get it healthy? And let's just start by giving your body everything it needs. Then we'll tackle the infections. Then we'll rebuild your gut. Then we'll balance your hormones. And then we'll do a proper detox if necessary.
Okay. So you start with the vitamin D and the iron, those two, and
I start
what
with those two
else?
particularly because every cell needs them.
Okay. Okay.
Oxygen cannot get to your cells unless it has iron to transport it. So you need iron. You need vitamin D. Start there. And then I give minerals and healthy fats like omega-3s and 6s. Just really any supportive type supplement you can find. But I don't recommend like more than 5. I personally hate
Yeah.
taking more than 8 capsules at one time, so I just won't do it. I won't tell other people that they have to take 25 capsules at one time because that's ridiculous.
Yeah. Okay. So starting there with the immune support and then maybe just broad next steps, because I know we are drawing up on our time together.
Yeah, here's what you're going to do. So we can only cover so much in 37 minutes here. And it's already
Yeah.
been a lot. Like, sit down, take it in, soak it in, go through your blood work and be like, holy crap, she's right. I know I'm right because I've done this thousands of times. I've been on hundreds of podcasts and I have my own podcast. So sink this in, go back and re-listen to it again if you need to. And just know that no matter what you've been told, you're not crazy. Your body just needs help. It's just trying to communicate to you that it needs help. You got to get it the right help. And that what you need is found inside your blood work. So there's 2 places to go to learn more. One, I have my own podcast, Beyond the Diagnosis with Dr. Kylie. We dive a lot into labs. That's my jam. So go follow that, Beyond the Diagnosis with Dr. Kylie. And 2, I have a book on Amazon called Why Are My Labs Normal? And it will break down not only the CBC, but the lipid panel, the iron panel, the metabolic panel, and a couple others. All right there in a simple, easy to read book. You can learn how to read your own labs the best way. So those 2 places will be where you want to learn more, but sit back. We talked about a lot of markers today because I know your audience is smart. And now you get to go take the information that you learned, apply it to your own blood work. And now your supplement cupboard might be 100 supplements like big, and you can minimize it down to 5 to 10 based upon what you need.
Okay.
That's a wrap.
And we've just scratched the surface. um, or maybe not even scratched the surface. You can't even see a dent. Okay, this has been an incredible conversation. Thank you so much for being here. And where can people find you? In addition to those 2 resources, your podcast and picking up your book, where can people connect with you?
Just stick with those 2 things. Come join the podcast because you'll hear other places on where you can learn and get help from, and then grab the book.
Okay. Well, thank you so much for your time, Dr. Kylie. This has been great.
Thanks, Brandy.